Welcome to Gateway 101. Okay. Welcome to Gateway 101. In today's live broadcast, we're going to be talking about a very common and recent occurring of stroke. There have been so many issues of people having stroke, and they don't know what are the causes of stroke. They don't know the symptoms. So we're going to be looking at the main causes of stroke. We're also going to look at the signs and symptoms of stroke. We're also going to be looking at some preventive tips. Okay, because that's all we do in Gateway 101. We create healthcare awareness. Okay, whatever we say here may not constitute diagnosis or treatment, but we are only creating a healthcare awareness. So we're going to be talking about what is stroke, what causes stroke, what are the signs and symptoms that you need to look out for. Okay, so we're going to be going through all this. Okay, to make sure you understand what we are talking about. Okay, so without wasting much of your time, we say that a stroke happen. Stroke happen when the blood flow to part of the brain is cut off. You know that the blood artery is like a hose that carry blood to all part of the body. So a stroke happen when the artery that is carrying blood when is cut off. The stroke happen when blood flow to part of the brain is cut off, or when a blood vessel in the brain burst. Okay, so what will cause a blood vessel to burst in the brain? We're going to be looking into all that too. Okay, so here is a clear breakdown of causes and risk factor. So the main cause of stroke, the most common stroke, also known as ischemic stroke, is most common stroke. About 85% of strokes are is caused by blocked blood vessels supplying the brain. So blood clot from the heart or neck artery, or atherosclerosis, which means the fattening plaques build up in the artery. So what we are saying is that a stroke would occur if the vessel that is carrying blood or the arteries that carry blood to the brain is blocked. Okay, when a vessel in the brain bursts, when a vessel in the brain bursts, this will cause stroke. Okay. Okay. Gibson. I'm sorry to hear that, but I'm sorry to hear that. You will not die of cancer. Okay. Check out some of our simple home remedy that that you can help to alleviate symptoms of cancer. When that does not constitute treatment, but just use some of our home remedies. Is check up our channel, Miss Gibson. There are some home remedies we have that will actually going to help you. Okay, it will be of great help to you. So you will be fine by the special grace of God. Okay, you will not die but live. Okay, so going back again to our topic of stroke, we said that a stroke happens when blood flow to part of the brain is cut off or when a blood vessel in the brain bursts. Okay, so I would say that the most common cause of stroke, 85% of stroke, is caused by a blocked blood vessel supplying the brain. We also said that blood clot from the heart or neck artery can also cause stroke. Atherosclerosis, which is the fattening plaque buildup in the artery, can also cause stroke. A narrow carotid artery in the neck can also cause stroke. So another cause of stroke would be hemorrhagic stroke. Hemorrhagic stroke. Hemorrhagic stroke is caused by bleeding in or around the brain. Okay, high blood pressure, most common cause of a hemorrhagic stroke. Please kindly like and subscribe to my YouTube channel. Okay, kindly like and subscribe to my YouTube channel. Thank you. So high blood pressure is most common cause of hemorrhagic stroke. Rupture of the aneurysm, or a blood vessel that ruptured, can also cause this kind of stroke. Arteriovenous malformation, AVM, can also cause this type of stroke. Head injury or blood thinning medication can also cause this type of stroke. Transient TAA, which also known as a temporary blockage that can be resolved. Okay, it's a mini stroke. Transient ischemic attack, also commonly known as TIA, is a mini stroke. It can be temporarily resolved. It's a temporary blockage that can be resolved, okay, if properly treated. Major warning sign of future stroke. It's also a major warning sign of future stroke. TIA is also a major warning sign of future stroke. So major risk factor, controllable risk factor. These are the big ones you can act on. 1, high blood pressure, number 1 risk factor of stroke. So they are controllable. Okay, with medication, diet, and exercise, you can bring high blood pressure into proper manageable range. Diabetes is another big major risk factor, but it's also controllable with proper diet, medication, and exercise. High cholesterol is another major risk factor, but it's controllable. It's another major risk factor for stroke, but it's controllable. Smoking of cigarette, vaping, taking illegal drugs, those are major risk factors that can cause stroke. Obesity and physical inability, they are also a major risk factor that can, though they are major risk factor, but they are controllable risk factor. If they are not, that can cause stroke. So losing of weight, 10 to 25% of your weight loss will be of great help, and engaging in physical activity, 30 minutes per day or 150 minutes a week will be of great benefit. Okay, so unhealthy diet, eating high salt, sugar, processed food, those are major risk factors, but they are also controllable. Controllable in the sense that you can avoid eating high salt, you can avoid eating sugar, you can avoid eating or limit eating processed food. So heavy alcohol use. Heavy alcohol use is a major risk factor, although it's also a controllable risk factor. So limit your alcohol intake. And if you're somebody of high risk, I would advise you to just stop taking alcohol, because prevention is better than cure. Okay? Drug use, like I said before, cocaine, methamphetamine, AMP, crack, cocaine, all those are major risk factors for stroke, but they are controllable. Heart condition, arterial fibrillation, heart failure, those are major risk factors, but they are also controllable with proper treatment. Okay? Non-controllable risk factor, you cannot change this, but they matters. Remember, we just talked about controllable risk factor. Okay, they are major risk factor, but they are controllable. And but these ones we're going to talk about now, they are not controllable risk factor, because you can't change this, but they matters. One, age, risk rise after 55 years old. Yeah, after 55 years of old, you are at high risk of stroke. Okay, family history of stroke, you cannot change that. If you have a family history of stroke, you just have to be careful with whatever you take and whatever you do. So you stay away. If you have a family history of stroke, you stay away from things that will trigger strokes, such as high blood pressure, diabetes, high cholesterol, smoking, obesity, and lack of physical exercise, unhealthy diet, using alcohol, using illegal drugs, and health conditions. So if you have a family history of stroke, so make sure you control these factors that I just mentioned. Okay, sex, men have higher rates than women. Women have higher mortality. Okay, men have higher risk of stroke, but women do have higher mortality of stroke. So previous stroke or TIA, remember TIA is a sign that a future stroke is imminent. So if you have a previous stroke or have a history of, you have a previous stroke or TIA, make sure you control whatever you take or whatever you do. Okay, race, ethnicity, high risk in blacks population, Hispanic and South Asia population. So blacks, Hispanic and South Asia population, they have high risk for stroke. Less known risk factor, sleep apnea. Sleep apnea is a less risk factor that also contribute to stroke. Chronic stress is also high risk that can cause stroke. Pregnancy and birth control pill, especially with smoking. So if you are pregnant, you're taking birth control pill and you are smoking, you are at risk for stroke. Inflammatory condition, e.g. lupus. If you have inflammatory condition, you are at high risk for stroke. COVID-19 increasing clot risk in some people. Okay, so stroke prevention start with you. Stroke prevention start with controlling your blood pressure, quitting smoking, managing blood sugar and cholesterol, exercising 30 minutes most day and 150 minutes a week, eating a healthy diet, regular medical checkup. I can't over emphasize that. You need a regular medical checkup. Okay? Because we strongly believe that prevention is better than cure. So if you are a candidate for stroke or you have a family history of stroke, you have TIA. TIA is showing it's a temporary stroke, it's a mini stroke, but often resolved. You have a high blood pressure, you are diabetics, you have a high cholesterol, you're obese, make sure you go for regular medical checkup, okay? Because we strongly believe that prevention is better than cure. So make sure you go for regular medical checkup. So let's talk about signs and symptoms of stroke. What are the signs and symptoms of stroke? Okay, let's look into that. Okay, what is a stroke? What are the signs and symptoms of stroke? Like we said, that a stroke is a medical emergency. Okay, it happens when blood flow to part of the brain is blocked, or when a blood vessel in the brain bursts, causing brain cells to start dying within minutes. So it is a medical emergency. Okay, a stroke is a medical emergency because a stroke is a medical emergency because it happens when blood flow to part of the brain is blocked, or when a blood vessel in the brain bursts, causing brain cells to start dying within minutes. So common signs and symptoms of stroke. Okay, using the FAST rule. We use FAST rule to remember the most important warning sign. One, face dropping. One side of the face drop or feel numbed. When you smile, look uneven. These are common signs and symptoms of stroke. Okay? Very common symptoms. When you smile, your face does not look equal. Then your face, one side of your face is dropping, or you feel numb. Then you have your arms are weak. You have arm weakness, sudden weakness or numbness in one arm or one leg. Those are very, very serious common symptoms of stroke. So you can't raise both arms evenly. You cannot raise both hands evenly. Those are signs, symptoms and signs of stroke. Speech, difficulty speaking, or your speech becomes sluggish speech, trouble speaking or understanding a simple sentence. These are signs and symptoms of stroke. Okay. Time to call. It is time to call emergency. So we having all these symptoms I just mentioned, having all these signs and symptoms that I've just mentioned, call 911 or call your local emergency number immediately. Okay, so let me go through it again one more time. We're using the FAST rule. The FAST rule, F stands for face dropping. One side of the face drop or feel numbed. When you smile, it is not even. One side of the face look one side is up, one side look weak. You have a funny smile. A, remember we're using the FAST rule. A stands for arm weakness, sudden weakness or numbness in one arm or leg. You can't raise both arms equally. These are signs and symptoms of stroke. Speech, difficulty speaking. You have a sluggish speech. You have trouble speaking or understanding simple sentence. Then T, it is time to call emergency. Call 911 or call a local number immediately. So other stroke symptoms that we're going to be looking at, this can appear suddenly. One, numbness or weakness on one side of the body. Numbness or weakness on one side of the body is a symptom of stroke, but this can appear suddenly. So sudden confusion or memory trouble is also a symptom of stroke. Trouble seeing one or both eyes. You suddenly become blind, legally blind. Those are symptoms of stroke. Sudden dizziness or loss of balance or trouble walking is also symptom of stroke. Severe headache with no cause, those are also symptoms of stroke. Trouble swallowing, loss of consciousness in severe case. Okay, when you lose consciousness, this is emergency. You got to call somebody got to call 911 and take you to the emergency room. Okay. Specific sign of certain stroke, ischemic stroke. That's a blood vessel. It's a blocked blood vessel, weakness or numbness, speech or vision problem. Hemogenic stroke. Hemogenic stroke, bleeding in the brain, sudden, severe, worst ever headache. You have this pounding headache that never subsides. You're taking all medication, but the headache never seems to subside. Those are uh, signs and symptoms of stroke. Okay, those are signs of stroke. Severe and worsening headache. Taking all sorts of medication, do all sorts of exercise, hydrate yourself, and you still have this pounded headache. Those are signs of stroke. Sensitive to light. Okay, you cannot look light. Anytime you look at light, you have problem looking at light. Those are signs of stroke. Rapid loss of consciousness. Because that's emergency right there. You gotta go to the ER. Important to know, stroke symptoms may be painless. They can be temporary, e.g. tear, mini stroke, but still an emergency. Early treatment save brain cell and life. Okay? So let's look about some stroke prevention tips. Let's look at some stroke prevention tips. Look at some stroke prevention tips. Stroke prevention is very doable with the right daily habit and medical care. Okay, so let me break it down into a natural lifestyle and medical prevention, plus when to be extra careful. How to prevent stroke, natural lifestyle prevention. These are the foundation, powerful and proven. Control your blood pressure, most important. Do not forget that one of the leading causes of stroke is blood pressure. So natural lifestyle prevention, we are saying that control your blood pressure is more important. It's most important. Limit salt or avoid processed food. Okay. Eat potassium-rich food, e.g. banana, beans, spinach. Exercise at least 30 minutes, 5 days a week. Manage stress, deep breathing, prayer, meditation, walk, and also high blood pressure causes 50% of stroke. That's a very, very high number. So if you have a blood pressure, make sure you take your medication, exercise, diet. Balanced diet will be of great benefit. And trying to manage your stress. So eat a stroke protective diet. What do we mean by stroke protective diet? We'll talk about stroke protective diet. We'll refer to you should focus on vegetable and fruit, fatty fish like salmon, sardines for omega-3, major gains, nuts and beans, olive oil instead of butter. Okay, so avoid fried food, avoid sugary drink, avoid red and processed meat. In Mediterranean or DASH diet, reduce stroke risk by up to 30%. Exercise regularly, brisk walking, cycling, swimming, aim for 150-minute walk. Even light daily movement helps. Maintain a healthy weight. Okay, belly fat increasing stroke. Belly fat increasing risk and stroke risk. So losing 5 to 10% of body weight helps BP, sugar, and cholesterol. Control blood sugar, especially important if you're diabetes or pre-diabetes. Reduce refined carbs and sugary snacks. Okay, pay carbs and protein fiber. Quit smoking or limit alcohol. Quit smoking and limit alcohol. I mean to say, smoking double risk, stroke risk. Smoking double smoke risk. So alcohol must at least one bottle per day. Sleep well, at least 7 to 9 hours sleep. Treat sleep apnea if present. Big hidden risk. Sleep apnea can actually cause stroke. Medical prevention, doctor guide. These are crucial if you have risk factors such as high blood pressure. Take medication as prescribed. Don't stop suddenly, even if BP feel fine. Cholesterol lowering drug. Okay, cholesterol lowering drug reducing particularly buildup, especially important if you are diabetes, pro stroke, or you have heart disease. Blood thinner if you need, example, aspirin for low dose. Clopidogrel gel. This is Plavix. Yeah. Then you can also take Coumadin for atrial fibrillation. Often take this if prescribed. Self-use can be dangerous, so you can never take all this medication that I've just mentioned if you are not under proper medical supervision. Okay, okay. So treat underlying condition, for example, atrial fibrillation, irregular heartbeat, diabetes, heart disease. Know the warning sign. If prevention fail, act fast. So the warning sign would be face dropping, arm weakness, sluggish speech. Time to call 911. If you notice any of these signs I just mentioned, I will measure them again. Your face is dropping, your arms are weak, one side of your arm is weak, one side you cannot raise up one side of your arm properly, your speech is sluggish and it's not coordinated. Time to call 911 immediately and go to the AR. Okay, so bed prevention strategies combine lifestyle and medical care. Even on medication, lifestyle change are not negotiable. Okay, so long-term changes is lifestyle changes is non-negotiable if you want to stay off of stroke. So let us recap again, and let's recap again. So we'll say that a stroke is stroke prevention is very doable. Okay, this is most important. Stroke prevention is very doable with the right daily habit and medical care. I will break it down clearly into natural lifestyle and medical prevention, plus when to be extra careful. We are saying that natural lifestyle prevention, these are the foundation, powerful, proven. Control blood pressure, most important. Limit salt intake, avoid processed food, eat potassium-rich food such as banana, beans, and spinach. Exercise at least 30 minutes to 4 minutes daily. Manage stress, deep breathing, prayer, meditation works. Do not forget, high blood pressure causes 50% of strokes. So if you're a high percentage patient, make sure you pay attention to your blood pressure. Eat a stroke protective diet, such as focus on vegetable and fruit. Also eat fatty fish such as salmon and sardines for omega-3. Whole grain nut beans, also best friend. Olive oil instead of butter, also of great help. We also say that you should avoid fried food, avoid sugary drink, and also avoid red and processed meat. Okay, the Mediterranean or Dutch diet reducing stroke risk by at least 30%. That's a whole lot. Exercise regularly. Brisk walking, cycling, swimming. Aim for 150 minutes per week of regular exercise. Even light daily movement helps. Maintain a healthy weight. Belly fat increasing stroke risk. Losing 5 to 10% of body weight help BP, sugar, and cholesterol. Control your blood sugar, especially important if diabetics or you are pre-diabetics. Reduce refined carbs and sugary snacks. Pair carbs with protein fibs. We also said that you should quit smoking or limit your alcohol intake. Smoking double risk factor for stroke. And we also said that alcohol should be limited. Alcohol intake should be limited. We also said that you should sleep well. Sleep at least 7 to 9 hours daily and treat sleep apnea if present, because it's a big hidden risk. We also said that you can also use medication, medical prevention. These are crucial if you have risk factors such as blood pressure. So take blood pressure medication, take exactly as prescribed, and don't stop suddenly even if BP feel normal. Cholesterol lowering drug such as reduces plaque buildup in the artery, and especially important if you are diabetics. We also talk about blood thinner if needed. Example is aspirin low dose, Plavix, and Coumadin. These are blood thinner. Okay, but never take this medication without proper medical guideline supervision. Okay, only takes medication if prescribed. Self-use can be dangerous. Okay, atrial fibrillation, irregular heartbeat, diabetics, and heart disease. So know the warning sign. The warning sign are face dropping, arm weakness. One side of the arm is stronger than the other. Time to call 911. You have a sluggish speech. You cannot coordinate words. You cannot make a simple sentence. It's time to call 911. Okay. Best prevention strategy will be combine lifestyle and medical care. Even on medication, lifestyle changes are not negotiable. Okay. So these are some of the signs and symptoms of stroke. And remember, this does not constitute medical diagnosis or treatment. We are only creating healthcare awareness. Gibson, once again, I'm sorry to hear that, but I will pray for you, okay? So the good Lord will continue to uphold you and keep you safe to Himself, okay? God bless you and stay blessed. Never lose hope, okay? Keep the faith. God will help you. God will save you, okay? To come your way again tomorrow morning. This is Gateway 101 signing off. Bye for now.